Southwest Florida, welcome to another edition of Lee Pitts Live. We're so happy that you stayed with us here on this Sunday morning. We have a fabulous show in store for you. Some of my favorite guests are here. We're going to get a chance to talk to my friends from AIDS Healthcare Foundation, get a chance to talk to Amy and Yolanda. Also, Cindy Banyai is here with her perspective, and Tisha and Toya are back. All that's happening on Lee Pitts Live. We'll be right back. Southwest Florida, welcome back. We're so thrilled to get Amy Pinter and Yolanda Powell here from the AIDS Healthcare Foundation. Welcome to the show.
Thank you.
Thank you.
Good to get both of you here together for a change. I've had you separately before. Now I got the two big kahunas here at the same time.
Yes, it's nice to be back. Thank you.
And what's that process, Amy, internally when you are about to come on Lee Pitts Live? You just kind of figure out what different people should be best to talk about different topics. How do you try to mix it up? You got different departments and things like that?
Yeah, exactly. I try to look at, who's come with me before, what's going on in the world, and see who might be appropriate to come. And so yeah, I try to bring different guests, and Yolanda was ready, willing, and able this time, so here she is.
She's a big TV star.
Yes.
She's comfortable on television.
Thanks to the pit.
I'm gonna get back to some solid down the road questions, but one of the things that in my head here is when I think about the AIDS Healthcare Foundation, I think about the annual AIDS awareness day that we have here annually. Have we, now that in this is 2021, will we have one in 2022? Are you still something you're working on?
Well, so you're referring to the World AIDS Day celebration that we've had in Clemente Park the past few years. We did make the decision early in the year not to hold it this year because we weren't sure, what was going to happen with COVID. But what the committee has been doing is partnering with local agencies like Community Cooperative, and we've been attending their mobile food distribution events and handing out information about HIV testing and HIV services, HIV testing kits, condoms, and we've tried to pair that around other HIV awareness days that are going on. Like, for example, the 27th is HIV Testing Awareness Day, and we're doing an event with Community Cooperative on the 23rd in North Fort Myers.
Mm-hmm. Sounds good. Is there any possibility, Yolanda, that with everybody's energy focused on COVID, that they could start slipping and forget about HIV and AIDS? Did it get lost? Could it have gotten lost in the shuffle some kind of way?
Well, most definitely. You got to understand, you're in home, you're bored, you don't have nothing to do, so a lot of people are putting themselves at risk. And what I mean by at risk is unprotected sex. So yes, I'm afraid this year, this far, I've had 8 positives in my office. Usually I have that in a year. So you can see that it's not even a half a year yet and I already have 8 positives. So that shows me that per each one, there could be numerous of other people infected.
I see. That's just the ones that come in your office and get tested.
Correct.
You said 8 positives?
Correct.
And let's see, we're in June now.
And that was as
And that's considered
May.
a lot? In my mind, I was thinking it'd be a lot more.
Well, think about this. Per each one, there could be 10 to 20 or maybe more positives out there. Because we know that people do have multiple partners. 1, 2, they're having unprotected sex and not asking about their status.
I see.
So yes, it's depending on how many people you see through your office. Normally, I had that a year, and I usually tested about 100 people a month. Because of COVID, that dropped down to maybe 40, 50 people.
Gotcha.
So if you really look at that, the percentage of it, it's a lot.
Mm-hmm. Amy, who should get tested?
Well, the short answer is everybody. The CDC recommends that everyone between 13 and 64 be tested at least once, but people that are higher risk, as Yolanda mentioned, really should be tested more often. It's really important to know your status. It gives you the power and control, because if you are negative, you can have the opportunity to make changes to your behavior that would put you at less of risk of contracting HIV. And if you find out you're positive, you have the opportunity to get into medical care and address your health and stay healthy. So it's really important to know your status, and the only way to know your HIV status is to have an HIV test.
Mm-hmm. HIV has not gone away.
No.
With all the other stuff in the headlines and the news, that's one message that we want to make sure we bring home, right?
Correct.
Absolutely.
With HIV, like she said, everyone should be getting tested, especially those that fall under the crack, meaning people that are married, they feel because they have one partner, they should not get tested. We do know that people do step out of their relationship, so therefore
Really?
putting your partners at risk. So I believe that everyone, married, single, in a entanglement, should get tested, just so you know your status.
What are some other things you can do to reduce your risk?
There's a couple of things that you can do. One, be aware of your partner's status. Not having or avoiding a large amount of partners. Having unprotected sex, use a condom, or there are other medicines out there that we're going to talk about briefly, which is called PrEP.
Go right into it.
PrEP is a medication which stands for pre-exposure prophylaxis. So it's a pre-prevention, right, before sex, right? So you will take a medicine by mouth. It's a pill. You take one a day for as long as you want to be on it. That medicine will protect you. It will give you that prevention method for only HIV. Now, a lot of people think that it's completely covered with STD, HIV. No, unfortunately, it's a prevention method only for HIV.
That's prescription?
Correct. So what you would do, you will get tested first. You would do a 4th gen test to make sure that you are a negative, because this medicine, you cannot give it to someone who is positive. They will have a really bad reaction to it. So first will be to get tested to make sure that you are a negative. Once we establish that and a couple of other things, your liver, your kidney, then the doctor can prescribe that prescription for you.
Amy, PrEP is huge progress in terms of the medical advancement with HIV and AIDS treatment?
Absolutely, yes. It's, it's been around a few years, but not everybody's aware of it, so we're trying to make sure that people are aware. Like Yolanda said, it's pretty simple. It's one pill once a day, and if you take it, it really does reduce your risk of contracting HIV.
It sounds like, to me, it's generally would be for somebody who knows that their partner is positive, right?
Okay, let me clarify that real quick, Amy, if you don't mind me butting in real quick. So, with PrEP, you have to be negative.
Both people?
No, only the person who is negative takes PrEP. The person who happens to be positive, they will take their own HIV medicine, okay? Now, it's suitable. We have plenty of relationships that come through our facility that one person is HIV positive and the other one is a negative and has maintained a negative due to PrEP. So it's really, really important that people really get to know this information, and that's what I do in my office. I like to inform people. The test will come, but the information that has changed tremendously over the years, because a lot of people do have a stigma when it comes to HIV. So they're still thinking about the 80s and 90s, what was HIV back then? It's not the same now, right? Now we know how it gets into your system. Now we know what happens, the symptoms that comes with it, even though some people are asymptomatic.
I see.
Okay.
What happens if you test positive?
So the first thing that we do if somebody tests positive with us is assure them that they're not alone. You know, we're there to support them, we answer their questions, and we link them into medical care. And the first thing we're going to do, you know, when they see the doctor is, you know, do some lab work to see where the HIV is, what other health conditions that they might be living with as well. And we may even start them on medicine right then and there. We know that the sooner we start people on medication, the better the outcomes are. We're also going to link them into case management services for extra support. I think we all know how difficult it can be to navigate the healthcare system, and that's something the case manager can really help with. We can help them to apply for Medicaid, to apply for, you know, an ACA insurance plan. We can help them with community referrals. Maybe they need assistance with housing or mental health services. That case manager is also can kind of be a liaison with the physician or other physicians, and just really be a support system for that person. We just want, you know, we want our patients to know that we're here. We have a whole team to work with them. They're not alone, and you know, we're gonna get them through this.
It sounds like it's very important that you make sure you take your medicine. If you have to take medicine.
Yeah, we can treat and manage HIV like a chronic disease. And in many cases, if not most cases these days, it's one pill once a day. We don't have the, it's still a cocktail, but it's in one pill. So we don't have the plethora of pills that people used to take. But if you don't take it, it doesn't work.
Right.
So it's really, really important that, people that are HIV positive take their medications, because the medications do wonders, but they have to take it.
Just off the top, I mean, I see, celebrities, of course, Magic Johnson, seem to be living like a full life. So we're at the point now that people can live a full life if they do what they're supposed to do.
Yes, sir. Yes. He's a great example. I mean,
he is the poster child.
Right? He goes way, way back when he first came out. We were all surprised. But yes, as long as you're taking your medicine, a lot of our clients are becoming undetectable, which is a great thing. Undetectable means that the medicine is working and suppressing the virus all the way down to the bare minimum, where it can be picked up as easily as if someone that was not on the medicine. So it's very, very good, because in our clinic, we have about, 80%, 90% of our clients undetectable now?
87%.
See? So it's working. We know it's working. And we also know that once someone becomes undetectable, the percentage of then transmitting the virus to someone else is less than 2%. So that's a great thing, because I believe that once everyone knows the information and how to protect themselves, that is the only time that we will see a drop.
What's some major misinformation out there?
I'll tell you the main one that I hear in my office all the time. I know who I'm going to bed with. I know who I'm having sex with. That's what I hear all the time. Unfortunately, if you're not getting tested, you cannot tell someone has HIV. Back in the day, yes, because of their physiques, they got really, really sick back in the 80s. The medicine was not really doing anything for them. So yes, it was very noticeable back in the 80s and 90s. Now, they're as healthy as you and I. You can't tell just by looking at someone. Someone can tell you, oh, I'm negative, but how do you really know? Only by knowing your partner's history, then that's one of the ways that you can cut down the risk of getting HIV.
I see. What are some other goals of treatment?
So, as Yolanda mentioned, the ultimate goal is for our patients to be undetectable. And what that means, as she said, is, the medications control the virus. The virus wants to make copies of itself, and it damages your immune system in doing that. So the medications control the virus, suppress it, and allow your immune system to be healthy and protect you from, colds, flus, other things that can make you sick. So when people take their medication and take it every day, they get to the point that they're what's called undetectable. We don't see the virus when we look at their blood under the microscope. And again, as Yolanda mentioned, not only does being undetectable is the ultimate goal for you as the patient, because then you're healthy, but as she mentioned, there's almost no risk of transmitting HIV to someone else through sex if you're undetectable. So hence the community is healthier. And so ultimately our goal is an undetectable viral load and a healthy patient.
Can you get HIV from oral sex?
Okay, I get that question.
Less likely, but it's still possible.
There is a possibility, depending on the amount of time or how many times you expose yourself to that individual. It's very unlikely, though. However, because there's sometimes traces of blood that we cannot see to the eye, makes it a little bit more risky. However, when it comes to unprotected sex, that is the least risky.
Is HIV, is the stigma of HIV being the gay disease completely gone?
Oh, no.
It's not?
No, and it
No.
surprises me. The stigma's still out there. Not only is a gay disease, but like maybe you did something and you deserve it. You deserve to get it. I don't understand it, but it's
still there.
It's the information.
But anybody can get it.
Anybody. And how I come across to my clients, which I love to death, everyone that comes to my office, they become part of me. I'm big on information. Knowing, listen, if you're not doing ABC, how can you get it, right? As long as you're asking the proper questions, whether it's your partner, your significant other, someone you just met. What's so hard to say, do you know your status? I'm not saying no, I won't get with you, but I need to know. Is there any proof? Can we go get tested? It's that simple. But because of the stigma, because of the information lack of, a lot of people refrain from asking those personal questions.
Does it cost money to tap into AIDS Healthcare Foundation services?
No, sir, completely free to the public. It takes 15 minutes to know your results. With the test that I used in my office, it's called a rapid test. You get your results in 15 minutes. The only thing different between that test and the 4th gen is the days that is within
The window period.
the window period, which is for my test 90 days. So
Okay.
my test will go back 90 days prior to your day coming into the office, and that's your status.
Let's give we got a phone number and website that's been flashing on the screen, but let's say it verbally.
Yes, you can reach me. It's aidshealthcare.org or yolanda.powell@aidshealth.org. The number to our office is
keep looking at me.
239-337-2391.
Okay. Well, ladies, it's been a pleasure having you on the show. Looking forward to getting you back. Talking frank talk. That's what I like when y'all come on this show.
Thanks for having us. We love coming to see Lee Pitts live. Thank you.
All right.
Thank you.
Thanks for your partnership. As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like these fine professionals from AIDS Healthcare Foundation who are doing it. We'll be right back.
Lee Pitts Live is a Lee Pitts Enterprise production.
Hello, Southwest Florida. Thanks for watching Lee Pitts Live. Of course, I'm Lee Pitts. I hope you enjoy that particular show, but you can always catch us here on YouTube. Just click on the subscribe button down there. That way you can get your Lee Pitts Live on demand when you want it and how you want it. We also encourage you to watch our show on FOX4 and connect with us on all our social media platforms. Just type in Lee Pitts Live.